Here we are going to look at the anticoagulants. So the anticoagulants, and to begin with some questions, the first question we want to ask is, what are the what is the indirect factor 10A inhibitor? So indirect factor 10A inhibitor, what is the example? And the second question will be, what is the vitamin K antagonist? Vitamin K antagonist, and what is it? So we'll find out these answers and learn in detail. So to begin with, first we are going to look at the vitamin K. Vitamin K antagonist. So what does this vitamin K antagonist include? This includes the warfarin. Next, we look at the DTI. What is DTI? DTI is nothing but the direct thrombin. The direct thrombin inhibitors. This is nothing but the DTI. So under DTI, it includes, there is the parenteral. So what is this parenteral? The parenteral is nothing but, there it is monovalent. This is monovalent DTI, that is a argatroban. Next we have the bivalent. So what is bivalent? So under bivalent, it includes the DTI. So what is the DTI? The DTI, it includes the lepirudin, and there is also the decirudin and the bivalrudin. Next we move on to the oral variety. So under oral, what does this include? So oral, it includes the dabigatran. Next, we move on to the indirect thrombin inhibitors. Indirect thrombin inhibitors. So under the indirect thrombin inhibitors, it includes the unfractioned heparin, and also the LMHW. That is a low molecular weight heparin. So this includes the enoxaparin, then also it includes the dalteparin, then the tinzaparin, enoxaparin, dalteparin, tinzaparin, as well as the nadroparin. Enoxaparin, dalteparin, tinzaparin, nadroparin. Then there is also the indirect factor 10A inhibitors. So indirect factor 10A inhibitors. So what does this include? So indirect factor 10A inhibitors. So this includes the fondaparinux. Next, we move on to the oral direct factor 10A inhibitors. We'll move on to the oral direct factor 10A inhibitors. So the oral direct factor 10A inhibitors, this includes the river. It includes the rivaroxaban. Next, also the apixaban. Apixaban. Then it also includes the betrixaban, and the edoxaban. Now, what do we do? Now we'll be answering our questions. So the first question is, we asked was, what is the indirect factor 10A inhibitors? So indirect factor 10A inhibitors, it includes the fondaparinux. Then The other question we asked was, what is a vitamin K antagonist? Vitamin K antagonist. So vitamin K antagonist is nothing but the warfarin.